Hi, so today we're going to be talking about how you would go about an OHI with a patient during clinic. Today, our patient has three concerns, which is malodor, high abrasive levels, and also heavy quantities of biofilm. So, you would first begin by putting your patient in an upright position, and then you would also hand them a mirror so they could view their areas of concern, and also when you teach them how to brush and floss, they could show you if they understand the concept that you just taught them, and it just makes it easier with a mirror. So we're first going to start off by speaking of the dentrifics, which is toothpaste. Um, so since the patient has high levels of high abrasive levels, although a more abrasive dentrific removes biofilm and this patient also has heavy quantities of biofilm, the patient has too much of a high abrasive level that is needed to use low dentrifics. So dentinal hypersensitivity can stop. Um, the patient should also stay away from dentrifices with high percentage of abrasiveness, like Crest Multi-Care Whitening or Colgate Total Advanced, and go for dentrifics like Arm & Hammer or Cow brand that only have an abrasive percentage of 0.98, which is below the 2%, so it does not risk damaging of dentin or exposing cementum even more in general, but more in this patient that already has the high levels of abrasiveness. So I would recommend to use let's pretend like this is Arm & Hammer. I would recommend to use a smear or a grain rice of size amount when using toothpaste because more is less. So that's how I would start off first with talking about the toothpaste with the patient who has high levels of abrasiveness. Then I would move on to the toothbrushing technique. So I would recommend my patient to have a soft, brittle toothbrush. And I will be showing them the charter method because that's the best method for a high levels of abrasiveness. So you would only put a little bit. So to the toothbrush, you would only put very grain rice size amount. And then you would use the angle of the filament. I know it's kind of hard to see. Our filament of the crown of the tooth and place at the gingival margin, angled at a 45-degree angle, so downward on the tooth, on the 45 degrees to the long axis of the tooth, while using short and back vibrating strokes. And then you go downward on the tooth. And you would also repeat this on every single tooth. And make sure that the toothbrush is at a 45-degree angle. I would then continue by telling the patient that you have to make sure you brush for 2 minutes. A lot of people think that they brush for 2 minutes and they're really only brushing for maybe 30, 60 seconds. So it would be important to maybe time yourself till you get a feel of what 2 minutes feels like brushing your teeth. You should do it twice in a day, so it should be morning and nighttime, mostly recommended. And also make sure to change your toothbrush every 2 to 3 months or when the bristles are frayed. So I would also show that if the bristles are outwards on the toothbrush, that's also not going to do anything when you're brushing it. I might actually even hurt you more. So it's important to change your toothbrush 2 to 3 months. Then I would move on to the flossing method. Flossing decreases the quantities of biofilm this patient has. So we're gonna do it with the use of a floss holder. So you would tightly string floss on the holder like this. There's still toothpaste on my type it on. You would select an area to begin flossing. So let's do it on the second premolar since there's no toothpaste on that one. You would select an area to begin to floss, so right here. Set as fulcrum on the cheek or the mouth, so it's a fulcrum. Use a gentle seesaw motion to pass through the contact area, and then wrap tightly in a C around the tooth, and floss up and down on the mesial 3 to 4 strokes. It's kind of hard to show. So like a C on the tooth, on the mesial side of it. Then I would move on to showing them the mouthwash. Well, not showing them, but telling them what mouthwash they should use. Which would be antimicrobial mouthwash to help degrade the biofilm, the high quantities of biofilm that they have, and mouthwash that are ADA approved contain fluoride, which help with the demineralization in the areas of abrasion. And I believe also they should try to stay away from alcohol in the mouthwash or high levels of alcohol, because it can affect their high levels of abrasiveness, in the sense that it could cause a lot of hypersensitivity and pain. And then also with the malodor, they could use a tongue cleaner and start at the most posterior part of the tongue to the tip of the tongue. And if the gag reflex is triggered, start at the lateral border of the tongue to the opposite lateral of the border of the tongue. After showing all of this, I would make them use the mirror and show me exactly everything I showed them with the toothbrush and with the flossing, and just reiterate back to me what they understood with what dentifrice to use and what mouthwash to use. Alrighty, thank you.